Well, hello and welcome back to class. This is Applied Anatomy, AAP 301 for the College of Natural Health Sciences, Bermuda. My name is Dr. Delcina Bean Burrows, and this is lecture number 17, where we will be discussing the sensory system. So in terms of our lecture 17 objectives, at the end of today's lecture, students will become familiar with the divisions of the sensory system, be able to identify the functions of the sensory receptors, and be familiar with the effects of aging on the sense of smell, which is olfaction, and taste, which is gustatory. So let's begin our lecture today by discussing the sensory system, beginning with the sensory receptors. All sensors do the same thing. They take information in many forms and convert it into electrochemical impulses so it can be sent to the nervous system. Here is a list of some of the types of sensory receptors. We have the chemoreceptors, which sense changes in chemical concentration. We have pain receptors, the nociceptors, which sense tissue damage. We have thermoreceptors, which sense changes in temperature. We have the mechanoreceptors, which sense mechanical deformation of tissue. We have the proprioceptors, which sense changes in positions of joints. We have the stretch receptors, which sense changes in tissue length. And we have the photoreceptors, which sense changes in light intensity. Let's now look specifically at the somatic sensory system. We can divide the sensory system into the senses that sense the skin, muscles, joints, and organs, and the special senses, which is vision, hearing, taste, and smell, or olfaction, as it's also referred to. The somatic senses include touch, pressure, temperature, pain, and stretch. The specific receptors are the free nerve endings, which sense touch and pressure and produce pain, the Merkel's disc, which sense fine touch and pressure, the Pacinian corpuscles, which sense heavy pressure, and the Ruffini corpuscles, which sense skin movement and pressure. There are two important sensory receptors located in muscles. These are the muscle spindles and the Golgi tendon organs. Muscle spindles are located more centrally in muscles. These are the receptors involved in the reflexes we described in the nervous system chapter. Muscle spindles sense stretch, which is the change in muscle length. Golgi tendon organs, or the GTOs, are located at the ends of the muscle near the origins and insertions. These act as a protective mechanism to help keep muscles from pulling off the bone with extreme forces. For example, think of helping a friend move to a new house. You are holding an empty box while your friend fills it full of heavy objects. Eventually, the box becomes so heavy that it triggers the GTOs and your arm muscles relax, with the result that the box drops to the floor. Time now for our first and only What Do You Think segment. And remember, our What Do You Think segments are designed to help develop your clinical reasoning skills. Think back to a time when you experienced an injury. You probably feel the sense of pain in that same area of the body without having to think too hard about it. Why do you suppose that is the case? Let's now discuss the special senses. The special senses include taste, gustatory, smell, which is olfaction, hearing, and vision. We will be having a separate lecture on both hearing and vision. Taste and smell are very similar in that they are both sensed by chemoreceptors. This is why taste and smell are so closely related. Have you ever had a bad cold or sinus infection where you couldn't taste food? Smell actually accounts for a large portion of taste. Your sense of smell can distinguish between 2,000 to 4,000 different scents. The sense of smell is also closely related to the limbic system, the seat of emotions. This is why certain smells can trigger memories. Remember your grandma's oatmeal chocolate chip cookies or some other favorite that she or someone else in your family may have baked or cooked, and how content you were after eating them. The organs for taste are called taste buds and reside on the tongue. There are also taste buds on the walls of the cheek and the throat. You have about 3,000 taste buds altogether. There are 5 primary taste sensations. Taste are combinations of these primary sensations, which are sweet, sour, salty, bitter, and umami. The 5th taste sensation is called umami. This one is a hearty, meaty taste produced by L-glutamate. Taste receptors are more sensitive to unpleasant stimuli. For example, we are about 1,000 times more sensitive to acids than sweet tastes. Now let's discuss the effects of aging on smell. The sense of smell is often taken for granted, that is, until it deteriorates. As we get older, our olfactory function declines. Not only do we lose our sense of smell, we lose our ability to discriminate between smells. It has been reported that more than 75% of people over the age of 80 years have evidence of major olfactory impairment, and that olfaction declines considerably after the 7th decade. Recent studies have found that 62.5% of 80 to 97-year-olds have had olfactory impairment. However, it is widely accepted that taste disorders are far less prevalent than olfactory losses with age. Various anatomical and physiological changes that occur in the elderly may result in decreased sense of smell. These include the following. Both the number of fibers in the olfactory bulb, along with olfactory receptors, decrease noticeably with age secondary to sensory cell loss in the olfactory mucosa, along with a general deterioration in central nervous system cognitive processing functions. It is thought that age-related olfactory dysfunction is related to an increase in receptor cell death. Activation of the piriform amygdala region and the orbitofrontal cortex has been shown to be reduced in older subjects when exposed to stimulation. In some cases, olfactory loss may be secondary to age-related appositional bone growth, resulting in the pinching off of the olfactory phyla as they traverse the ethmoid bone. Certain general diseases, such as liver disease and non-otolaryngological cancers, seem to influence olfactory function. Another contributing factor when considering age-related olfactory deterioration is mild cognitive impairment and Alzheimer's disease. Now let's consider the effects of aging on taste. Gustatory dysfunction may indeed be related to the normal aging process. However, in many cases, what is perceived as a taste defect is truly a primary defect in olfaction. Other than smell dysfunction, the most frequent causes of taste dysfunction are prior upper respiratory infection, head injury, drug use, and idiopathic causes, chewing problems, associated with tooth loss and dentures can also interfere with taste sensations, along with the reduction in saliva production. Oral and pharyngeal disease, such as candidiasis, may be a factor. Changes in taste cell membranes involving altered function of ion channels and receptors. Taste bud loss is thought to contribute less to this problem, with no relation between taste acuity and number of papillae. And rather than whole mouth gustatory dysfunction, regional deficits are much more common. It has been reported that there is a higher prevalence of localized losses on the tongue in elderly subjects than in younger subjects. Despite their wide prevalence, most elderly people are unaware of regional taste deficits. Okay, so we've reached the end of today's lecture, and for assignment number 17, what do sensors do? And for this assignment, all you have to do is answer the questions. You don't have to write it in essay form. You just have to answer the questions in block form. So number 1 is what do sensors do? And for number 2, describe the different types of somatic sensory receptors. For number 3, what are the 2 types of sensory receptors present in muscles? For number 4, describe the relationship between the sense of taste and olfaction. And for number 5, describe the effects of aging on the sense of smell and taste. Now, this assignment is due on Sunday, this coming Sunday at 11:55 p.m. If you have any difficulty whatsoever with this assignment, you may send me an email or a text message. My office hours are always the same, Thursdays from 4 to 6 p.m. I look forward to receiving your assignments, and with that, do have a great week, and I will see you in the next lecture.